Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and welcome to Dental Sleep Medicine Insider Magazine. Today we're going to talk about what you need to do to be prepared to go talk to your medical professionals. So once you have an appointment ready to be set up, let's talk about how you get ready to do that. First of all, go there with the right idea. You have to understand that none of us would be doing this if CPAP worked on every patient. The problem with CPAP, as we know, is compliance, and the new practice parameters that came out in 2015 show that as many as 83% of the patients are non-adherent to CPAP. And then we're looking at a health situation, in other words, the alleviation of disease calculations, that oral appliances may actually be comparable to CPAP. And this is the message that we're going to want to get across at our meeting. So our goals of this meeting are that we want to learn about their practice. We want to talk about how dental sleep medicine might fit into their practice. We want to educate them on how successful dental devices are, and especially when it comes to compliance compared to CPAPs. We want to agree on our treatment approach and protocols to make sure it makes sense with what they want. And we also want to agree on the referral process, both to their office and from their office. Otherwise, before we go to meet the physicians, you're just going to have to be prepared and confident. Let's don't take a weekend course and then go meet 15 physicians the next day. Let's make sure you know what you're talking about and you're confident to them. We want to approach them by asking them that we have our patients that we're screening. We want to refer them to you. How does that process work? So we're giving them something as we approach them. Before we go to the meeting, we want to establish the details of the meeting. Are we meeting for lunch? Am I bringing lunch? Are we meeting at their office? How many people are going to be there? And then arrive on time, even a little bit early, and plan on staying longer than you think. They always seem to run late, and if you have a crown prep scheduled immediately thereafter, you may find yourself rushing to get there. So there's some things you're going to want to bring with you to the meeting. I've got a few of them here in my hand. You're going to want to bring, I think, a lot of times a copy of the Hokema book with the study in chapter 4 in the back. The practice parameters, the new 2015 from the DSM, I would like to put them on a zip drive and print out a summary sheet of them. I like to bring these, and we'll probably pull it up on the screen, a copy of this follow-up study from the Wisconsin Sleep Cohort. And of course some dental device models, whichever your favorite devices are you want to have. There's also some other studies I'd recommend you bringing. This new study that came out last September in New England Journal of Medicine from McAvoy. We'll talk about that in a little bit. I think that's a good idea. Business cards, brochures, referral pads, any other appropriate studies. And of course, if you agreed to bring food, bring that along, find out how many people you're feeding. And if it's a big group, a PowerPoint works pretty well. If it's a smaller group, I feel like it's maybe not necessary to bring that along. You're going to start by asking the physicians questions about about their practice when you meet with them. You want to kind of say, approach it that we'd like to refer you patients. We're screening our patients. We're looking at our patients, and some of them need their assistance. And let's ask questions that are gauged towards our goals of referral, like, what kind of treatment alternatives do you offer your patients? What about patients who can't wear CPAPs? What's your knowledge on dental sleep medicine? What do you understand about that? How would you like us to follow through with these patients? And so once we ask those questions, we want to make sure that we educate the physicians, but of course listen to them first is key. Let them do most of the talking at first. And once they give us a chance to talk, we're going to sit down and say, well, I want to make sure we're on the same page. Give them a copy of the DSM 2015 practice parameters. They probably aren't aware of it, most of them. They don't realize that dental devices and CPAP are recommended hand in hand together for mild to moderate patients and even severe patients. They can't wear a CPAP. I usually take that Hokema book and go over chapter 4 where we talk about success rates, 84% success rates for dental devices for mild to moderate patients. And for severe, it's 69%. If we're just trying to get them from severe back down to mild to moderate, or about 31% if we're going from severe to really no apnea. And I think that's where that Wisconsin sleep study comes into place, because we can show them that. Again, we'll show a close-up on the screen of this. But as you move from a severe apneic patient, 57% or so long-term survival rates after nearly 20 years, so it's not very good. We can move them up into the high 80s survival rate. And they have to understand that if they're going to wear the dental device. And the last is the newest piece of literature we bring, this New England medical journal that was out that shows that over 2,600 patients, that if we're looking to decrease cardiovascular incidence, that CPAP showed no effect on these. I mean, that's pretty substantial. That essentially they can't even recommend CPAP if we're looking to help this, because they assume it's because of the average of 3.2 hours of compliance. I mean, overall. So, CPAP works, we think, but if they're not wearing it, according to this study of over 2,000 people, they're saying that the CPAP's not even a viable treatment to decrease cardiovascular incidents. Let's assure them that if they send us the patients to us, that they're going to come back. They're going to get correspondence regardless of whether we treat the patient or not. We're going to show them the study models, let them understand how these devices work. And the main key thing when we leave here is, if they're going to refer us a patient, ask them to either call us with the referral or fax us the patient's name and let us call them. That way they won't fall through the cracks, because if they just tell the patient to call us, the patient may not call. They think we dropped the ball. In fact, maybe the patient never called us at all. Now, what are the patients going to ask you after? What are the physicians going to ask you after that? They're going to ask you a couple things. How much does it cost my patients, and does insurance cover it? That's the two biggest questions they're going to ask. And you just need to have some answers for that. Depending on how you handle insurance in your office, hopefully you do file medical insurance. And if you do, my answers to that are, look, we're going to treat your patient. The patient's ability to pay and their insurance co-pays, that all comes into play for how much it's going to cost them. So it depends. But we'll see your patient at no cost to them to evaluate them if they're a good candidate. And if they are a good candidate, we'll find out how much their financial responsibilities are going to be. And if they can't afford those for some reason, especially for the patients who really need this treatment, we'll work with them financially to make sure that it's affordable for them. So we're going to establish a procedure for them to refer to us and for us to refer to them before we leave. So this is one of our goals. How does that go? Again, we want them to call or fax us ideally, but how do we send patients to them? We want to review our treatment protocols, from consultation to impressions to delivery, follow-up subjective titrations to how are the follow-up sleep tests going to be done. Are we going to be in charge of that, the primary care, or the physician that we're meeting with? Do they want to do the follow-up test? Is it going to be home tests or PSGs? We've got to establish that so that we make sure that we're doing what they want. And hopefully at the end of all this, we can agree to follow the AASM, the AADSM 2015 practice parameters, which states that dental devices and CPAP are both first line of therapy. Hopefully they'll agree that if the CPAP patients can't wear their CPAP, they're going to come to us, and for the mild and more moderate cases, that they should be giving their patients an option. And again, we want to be respectful of their opinions, and hopefully at the end we're going to come to an agreement on all those protocols. And if we do, let's write those down, and then let's follow those protocols. Now, lastly, one of the most important things is all this pays off and a patient calls, and a patient says, I'm coming in and they're getting this referral. This should be all hands on deck in your practice, because the front desk, everybody in that practice needs to know that this is an important patient. Let's make sure that we see them on time. Let's make sure we do a great job of our consultation. And if they are a good candidate for a dental device, by all means, let's make sure that we follow up with this patient and make sure, even if they have financial concerns, that we somehow make it affordable for them to treat, because this first patient might be the gateway to a lot more. So let's get them treated and treat them well, and that includes a lot of communication. Communication is the key with making these physicians happy. They want documentation, they want letters. We like to do them through DS3, through our digital fax, and we send them after the patient decides yes or no to treatment, whether they do treatment or not. We send them correspondence typically at the delivery, at their first device check, after the sleep test, and when their treatment's complete. And you know what? If the treatment drags out for some reason, the patient goes on vacation, every 6 weeks at least, we're going to want to send our referring doctor some form of communication to let them know that we haven't dropped the ball. So if you do all those things, have an organized meeting with confidence, agree on protocols, treat the first patient that comes in, no matter what you have to do, as long as they're a good candidate, you're going to get these physicians referring. But also just remember, it takes time, and every physician doesn't get it. It's oftentimes like fishing. You might catch a big one day, and for weeks you may not catch anything. But once you catch a big one and you get a physician that gets this, they're going to refer you patients. And it really only takes one physician that gets it to really make a busy dental sleep component to your practice. I hope this has been helpful. Again, I'm Dr. Guy Yatros from Dental Sleep Solutions in DS3, and thanks for reading and tuning in to this episode of Dental Sleep Medicine Insider Magazine.